Recognizing cancer's early warning signs and symptoms can greatly enhance treatment success rates and patient outcomes. It's crucial to remember that having one or more of these symptoms does not necessarily suggest you have cancer, because they can also be brought on by a number of other disorders. However, it is essential to speak with a healthcare provider for an accurate assessment if you observe any persistent or odd changes in your body. The following list of typical cancer symptoms should be familiar to everyone. Unexpected weight loss. Significant and unintended weight loss, particularly if it happens quickly without dietary or exercise modifications, can be an indication of a number of cancers, including esophageal, pancreatic, stomach, lung, or pancreatic cancer. Fatigue. Several malignancies, including leukemia, colon, and stomach cancer, might show symptoms of persistent, unexplained fatigue or exhaustion that does not get better with rest. Chronic or persistent pain that doesn't seem to have a clear cause or that doesn't get better with time needs to be investigated. Many malignancies, including ovarian, testicular, and bone tumors, can cause pain as a symptom. Skin changes. Moles that appear suddenly or change in size, shape, or color may be signs of skin cancer. Concern should also be expressed if any wounds or sores do not heal or heal slowly. Changes in bowel or bladder habits. Colon or rectal cancer can be detected by persistent changes in bowel habits, such as constipation, diarrhea, or narrowing of the stool. Additionally, certain malignancies, such as bladder or kidney cancer, might be detected by blood in the stool or urine. Hoarseness or persistent cough. Lung cancer might be indicated by a persistent, long-lasting cough, particularly if blood is involved. Hoarseness or vocal alterations that last longer than 2 weeks may also be an early sign of laryngeal or throat cancer. Difficulty swallowing or indigestion. Esophageal, stomach, or throat cancer may be indicated by persistent swallowing issues or a sensation that food is becoming trapped in the throat. Consistent stomach pain or frequent indigestion might also be cause for alarm. Breast tissue changes. A healthcare provider should be seen if there are any breast tissue changes, such as lumps, thickness, edema, or nipple alterations, such as discharge or inversion. These might be breast cancer warning symptoms. Unexpected bleeding or unusual discharge from any region of the body, such as rectal bleeding, blood in the urine, vaginal bleeding in between periods, or postmenopausal hemorrhage, may be a sign of a number of cancers, including colorectal, kidney, or gynecological cancer. Persistent infections or sores. Frequent or recurring illnesses, such as urinary tract infections or lung infections, may be symptoms of a more serious condition, such as leukemia. Keep in mind that effective cancer therapy depends greatly on early detection. A healthcare expert should be contacted right away if you notice any of these symptoms or have any worries about your health, in order to receive a thorough evaluation and sound medical counsel. Many of us have postponed the annual tests and checkups where tumors are frequently identified in an effort to protect ourselves from coronavirus. It makes sense that way. However, one of the finest tools in the fight against the disease is early detection. Screenings can find cancers before they cause symptoms. By closely observing changes in your body, you can spot early warning signs on your own. Contact your healthcare physician if you discover anything new or different that persists for a few weeks, and a few weeks is important. Not all cancer symptoms are indeed cancer. But these 17 signs can make you want to call your doctor. 1. Unusual menstrual cycles or pelvic pain. Most women occasionally experience cramps or an irregular period. However, prolonged pain or alterations in your menstrual cycle may be indicators of ovarian, uterine, or cervical cancer. 2. Modifications in bathroom usage. Among other cancers, significant changes in physiological functioning might be a sign of bladder, prostate, or colon cancer. Constipation or diarrhea that doesn't go away, blood in the urine, black, tarry stools, blood in the stool, or red or black blood in the stool are all warning symptoms. 3. Swelling. We've all experienced occasional bloating. However, bloating that lasts longer than 2 weeks may indicate ovarian cancer as well as other gastrointestinal cancers. 4. Breast alterations. A new lump, dimpling, discoloration, changes in the area surrounding the nipple, or an odd discharge that you didn't have before are examples of these. Men can also get breast cancer, despite the fact that women typically do. 5. A persistent cough. A cough that lasts longer than 2 weeks, especially one that is dry, may indicate lung cancer. 6. Regular headache. A brain tumor may be the source of a headache that persists for longer than 2 weeks and is unresponsive to standard treatments. 7. Trouble swallowing. It may indicate stomach, lung, or throat cancer if you experience difficulty swallowing for longer than 2 weeks or feel as though food is becoming trapped in your throat. 8. Significant bruising. It's typical to sustain a shin bruising from slamming against the coffee table. But suddenly developing numerous bruises in strange locations where you haven't been hit can be a sign of several blood malignancies. 9. Regular infections or fevers. It can be a sign that lymphoma or leukemia has compromised your immune system if you keep getting fevers or have recurrent infections. 10. Oral alterations. Particularly in smokers and heavy drinkers, persistent sores, lesions, or painful mouth areas may be signs of several oral malignancies. 11. Skin alterations. A medical professional should evaluate any change in a mole or birthmark, either in person or via video visit. Use this simple mnemonic, ABCDE, to help you recall which changes to be concerned about. Asymmetry. A mole or blemish that has one half that differs from the other. Border. The borders are jagged or fuzzy. Both black and brown are uneven in terms of color. It has a diameter that is greater than a pencil rubber. Any mole that bleeds, develops, or otherwise alters over time is considered to be evolving. 12. Persistent pain. Any persistent discomfort in your body that is unrelenting, has no obvious explanation, and is not relieved by conventional remedies needs to be examined. 13. Constant tiredness. No matter how much sleep you've been receiving, a sudden, significant change in your energy level could be an indication of lymphoma or leukemia. 14. Menopause-related bleeding. There are several causes for this, but if it continues, your doctor might want to examine you for uterine or cervical cancer. 15. Nausea or stomach aches. Unusual discomfort that persists for longer than 2 weeks may be an indication of malignancies of the liver, pancreas, or different parts of the digestive system. 16. Unaccounted for weight loss. Weight changes. However, gaining weight without trying or losing appetite can be signs of a variety of malignancies, particularly those that have spread. 17. Strange lumps. Any new tumor or lump that persists should be examined. When you have a cold, your lymph nodes frequently swell, but if the swelling continues after you feel better, you should see a doctor.